Welcome to Inside Personal Growth Podcast. Deep dive with us as we unlock the secrets to personal development, empowering you to thrive. Here, growth isn't just a goal, it's a journey. Tune in, transform, and take your life to the next level by listening to just one of our podcasts. Well, welcome back to Inside Personal Growth. This is Greg Voisin, the host of Inside Personal Growth. And the two guys on the other side of the screen over there, I got to get a smile out of them because it's a Thursday. And the reality is that I assist a company called CellMix, and I'm involved in the healthcare field in many different ways, all the way from helping develop apps for Mayo Clinic, to speaking with gentlemen like themselves. To the right of you on the screen, for those of you who are actually watching this on YouTube, is Dr. Trever Wilkins, and to the left of you on the screen is Carter Kerber, and both of them have an organization called optimizeyourhealth.com, optimizeyourhealth.com. There, we'll put a link in the blog to that as well. I'm going to let him know a little bit about you, Dr. Wilkins. He's a DO, Director of Medicine at Optimize You. He's a trained emergency medicine physician with a passion for cutting-edge health modalities and well over a decade of experience in the medical field. He graduated from medical school at Kirksville College of Osteopathic Medicine in 2010. And during his time he spent in the ER, he developed the notion of providing a regenerative approach using one's own body to assist in the healing of many ailments. If you want to learn more about him, you can go to the website. Again, that's Optimize Your Health, and that's optimizeyouhealth.com. Carter actually works with Dr. Wilkins, and he is at Optimize Health as well as a physician assistant, but he's really more than a physician assistant. He's got amazing credentials. He had a CES certification, began his career as an EMT, providing critical care in time-sensitive situations. After 3.5 years of service, he moved on to working in the ER, where he was taught to be calm and methodical, even in tough situations. Carter then attended PA school, the rotation train of Midwestern University in Glendale, where he found his passion in helping others reach their full physical and mental potential and performance in medicine. Again, you can find more about him at the website as well. Well, both of you gentlemen, thank you for joining us. You both have tremendous backgrounds. And Trever, I just want to throw this out. You, in that little bio, you told a bit about it. Both of you can comment on this if you would. Regenerative medicine today has expanded so far. There's been so many advancements in it, and it's doing so much to help people heal pain. Basically, why did you guys get into this, and why have you kind of chosen the alternative route versus more invasive procedures?
Thank you so much, and thanks for having us, by the way. I like to think that I've always been athletically minded. And so from a young age, always thinking about what I could do to perform better. And, that led to an exercise physiology degree, and then decided to go into medicine, and then really became intrigued with emergency medicine, just with the pace. And I still do that, and I love it. But doing emergency medicine, aside from these big safe procedures and interventions, there was just this obvious lack of what was needed by the community. And after a few years in the emergency department, that started to weigh on me, and I started to look at, these people are coming in, and a lot of them aren't getting the answers that they need. And that started me on a journey about learning about what else is there that can really address some of these underlying issues. And that ultimately led to this regenerative approach with an emphasis on lifestyle and really focusing and really embracing that that part of health, which is so crucial. And in that, I was able to discover, in conjunction with conventional evidence-based medicine, that there's so much more that's out there to offer. There's a huge gap between conservative medicine and surgery. And there were so many people that I was just seeing on a regular basis that were in that gap. They weren't surgical candidates. They weren't getting better. And being
It's interesting you say that, Trevor, because we've had a couple other physicians on, one in particular, Dr. Jeff Larson, who was a neurosurgeon and back surgeon. He basically, for a large degree of his patients, quit doing it. There's been many doctors who've written books saying, we're not going to do back surgery because it's not working. And I've cited that, meaning that it's actually worse after the back surgery. Now, I'm saying in all cases, I don't want to be an advocate for people to say, no, don't do back surgery. But on the other hand, you know, when you look at a shoulder pain or a knee pain or hip pain, I hear the stories about people afterwards. And I realize that not only is it a long healing process, it can be very excruciating pain. Now, Carter, for you, you have a similar background in this. Can you tell us a little bit about why you were so, you know, ready and willing to join Optimize You Health, and Trevor, to kind of get into this?
Yeah, of course. Well, once again, thank you for having us on. Kind of funny. Yeah. I mean, I have a background in emergency medical technician, did that for 3.5 years. So undergrad, medical biology major, minor chemistry, math. Also worked in a Sioux Falls Bavaria ER as a patient care technician for a good 2 years. So getting to PA school, automatically thought I was going to be doing something emergency. Thought about being even like a combat technician in the military. However, during my ER rotation, actually, is when I found Optimize. And I actually, you know, reached out, set up a kind of a student rotation with them. I was interested in that sports orthopedic side of things. Just, I call myself a jack of all trades, master of none, because I did wrestling, track, swimming, tennis, you know, football, basketball, pretty much everything that you could do. And so I love staying active, getting outside, and my mom, for sure, I have to thank her. She's super holistic, you know, fed me. She wouldn't even buy me baby food. She would make her own baby food. So like combine a bunch of vegetables, blend them together. And so I definitely feel good and thank her for that pathway as well. But yeah, Trevor took me on. They set up, I did some rotations and then hired me on to do a short fellowship, specifically training me in musculoskeletal or ultrasound, you know, these orthopedic procedures, hormone replacement therapy, peptide therapy, bunch of kind of cool, innovative stuff. And that kind of led to now.
Well, it's good to have both of you on. And I know I told Trevor about this in a pre-interview that I was just at Dr. Steve Berman's house, an emergency room doctor. He became a hypnotherapist and is now working with Andrew Weil and the Noetic Institute. And, you know, that's over in Arizona, where you guys are. Again, for everybody, they're in Chandler, Arizona. If you want to check them out, go to the website again, optimizeyouhealth.com. That's where you'll find out they're in Chandler. And both of these gentlemen are really cutting edge at what they're doing. And I like the whole area of noetic medicine, the whole idea of the way you communicate with your patient is really the way they can heal. You tell somebody they have cancer and you go, well, you only got a 10% chance, of survival. That's not the story they want to hear. They want to hear something encouraging from the physician. So there's been major studies done, and you guys know, and I know both of you treat your patients this way because I can tell you're really treating them very holistically, saying, hey, look at this on the bright side. There's a much better way to go about this and a better way to look at it. And I believe there's such a strong connection between the neuroscience that's going on up here and what's happening down in the body. So with that being said, you guys approach everything with like really minimally invasive stuff. You're not going in to make big cuts and pull things out and do whatever. You're saying the body can heal itself. So how were you first introduced to the IntelliFat Beauty kits, and what are your initial impressions of their potential for pain management and so on. So what's really happened with you guys with that?
Yeah, once again, kind of the common theme is we didn't have all the tool sets that we needed in conventional medicine. We can use some of those for certain situations. In the ER, somebody needs a bone reduced or cardioversion or something like that. That's great, but we started with different. We had been using PRP, platelet-rich plasma therapy, where you take the blood for a while for years and had really good results with it. And we went to a conference, a very reputable Toby conference, and we were seeing just really good new studies where a lot of MDs, DOs are starting to publish the effects of adipose specifically. And what really caught our attention at that conference was the actual properties of the adipose could be used as scaffolding. And so if you had like a large tear, this a lot of times historically would require surgery. You could actually go in and once again, ultrasound is such a huge innovation part of the progression of medicine right now. But you can see those defects and use adipose tissues as not only just a regenerative part of the treatment, where the cells are differentiating and becoming the tendons stronger and better compared to surgery, where oftentimes you're taking away or using a cadaver tendon. But you had that property plus almost a scaffolding where you can fill it in like putty. And and they were showing case after case where a year later, you couldn't tell that there was a defect to begin with. And the MRIs would actually thought that it was a cadaver lab because it replaced the tissue so well. And so we started thinking about these cases, and the FDA kind of made it a little bit more challenging a few years ago to get into this. And we thought we needed to do this. And we found a way and to do it right and within the bounds of practicing medicine safely. And we have been so happy since we've done it, because the effects have given us even more capability than what we had been used before with PRP, which is still awesome and we still use. But when we found out about that and utilized it, we have been so pleased with results.
So the IntelliFat kits have worked well, and this is not meant to be a commercial. What we're really trying to do is educate people that there are alternative ways, right? And there are alternative ways. I mean, look, you use other things besides the IntelliFat kit as well. I'll be honest with you. I just went down and got a red light laser treatment on a Thor machine for my knee that Dr. Berman did for me. And he does them like every other, because I got hit by a dog in a dog park and he knocked me off my feet. And I can tell you, after 6 treatments with the red light and the laser on the Thor machine, which is not a cheap machine, to literally put it on there and heat it up and do it, this knee is like almost, it's like literally healed since I got hit by that dog. And I was in excruciating pain. So I'm not saying, hey, you got to go get IntelliFat, but if you have cases where you guys believe IntelliFat can work, and you pull out the adipose and you filter it, and then after you filter it, you literally end up with the fat that you can inject back into either the shoulder or the knee or the hip or wherever you're doing it. So this question basically coming up here, Carter, is for you. It's kind of around the mechanism. Can you explain how the IntelliFat kit works? What's the scientific principles behind it, their effectiveness in treating the pain? Because of all of the things you could do, we've heard from doctor after doctor after doctor, and we're glad to have you guys on as well, that it has worked phenomenally well about 85% of the time, that we're seeing huge improvements after 6 weeks. Now, there is some swelling. We understand that. But the reality is, Tell us a little bit about it. You're the one that's doing it.
Yeah. I mean, I'm just implementing an idea that Trever brought, but the IntelliFats, I also want to thank like the Toby and AAOM conferences as well. Some cool conferences where innovative physicians meet up, and they also were able to elaborate and explain a lot of things to us as well. But the IntelliFat kits are pretty neat. We started off doing a lot of PRP with A2M, trying to decrease arthritis progression. It works great for a lot of soft tissue repairs, tendon ligaments, but we wanted to do something that hit like osteoarthritis a little bit harder, like almost irreversible degeneration. And there's not a whole lot other than, surgery or steroid injections, which we know don't ever last. And so at the very basics, the adipose stem cell procedure just seems to be super advanced to the point where I found out that there was more mesenchymal stem cells actually in your fat tissue than there was mesenchymal stem cells per volume in bone marrow. Albeit there is more bone marrow stem cells, just different versions of them. But when we kind of found that out, now we know that when we concentrate that and we actually use it with PRP, the adipose stem cells and those lipid cells will actually create like an extracellular matrix. And then in doing so, it does some cell differentiation. And so it can actually increase blood flow, some angiogenesis to the area, stimulating, not only just almost like a patchwork, but fibrocartilage repair. And most of the cartilage in like a knee, per se, is hyaline cartilage, but replacing that is extremely difficult. And with the adipose stem cells, it almost acts as a filler, regenerator, vascularization promoter. And it is like a combination of PRP, hyaluronic acid injections on steroids.
You say this, hate to interrupt you, but I remember speaking with a doctor on this podcast, and he said, not only in an invasive surgery, like a disc surgery on the back, we literally used the IntelliFat kit after, and the healing time was cut in less than half as a result of actually doing the injections after doing a disc repair and a surgery, which just is mind-blowing when you think about it, because there you are. I mean, it's right on top of something where somebody had invasive, yet they could have gone on for a long time to heal, but the healing response was just phenomenal. Makes sense?
I love to hear that. Yeah, that extracellular matrix can stimulate that a cell signaling pathway. It's like taking a satellite and distributing it multiple times, and that in itself helps, tell the body, well, this is what we need to repair. Let's go down and do more than what it already does.
And do you have some case studies, Trever, of people where you both have utilized these IntelliFat and the adipose on the patients and their success rate? I mean, do you have any stories that our listeners would go, I had a sore shoulder, but I couldn't play golf, or I couldn't play tennis, or I couldn't do the sports I want, or I couldn't run because the knee was bad, or whatever it might be. You have any great stories?
For sure. And the response from the patients has exceeded expectation. And just with the mechanism, once again, like you can't come up with a better drug if you try, because it has anti-inflammatory property. It has the actual, kind of putty property to it where it fills, and then it has the regrowth component to it. And just today, we had a patient that was following up for something else, and we're, just caught him in the hall, and how are you doing? Oh, he was so happy. His pain's improved. He's able to already do more. And this is a month out from the procedure. And it really makes sense when you think about those properties. It has the anti-inflammatory, it has some cushioning in there, in addition to the growth. But that's literally today before we came in.
He actually was about to get a knee replacement through Mayo, and was just kind of searching for some alternative options. It's nice to hear that people are hearing about this, but a lot of people don't know that they have these options.
I mean,
Was he gonna go to the Scottsdale clinic there and get the Mayo? Yeah, it's interesting because I've worked with them. We actually, the company that I helped with the app, developed an app for physical therapists that is it was the 24 Life app. It's now being used at Mayo, and it has 2,000 videos with exercises on it and all that kind of stuff. So really interesting. So what are some of the challenges you face when integrating regenerative medicine technologies like IntelliFat kits into your practice? And how do you guys address any of these challenges that you might have? One of the challenges we know from the outside is, hey, this is great stuff, but right now the insurance carriers aren't covering it. Let's talk a little bit about that.
Thank you. Yeah. Once again, one of the kind of the themes that led to the creation of this practice is the shortcomings in conventional medicine. And along with that, I mean, the hospitals are literally failing. And it's a failed system, yet patients still have that mindset of, hey, I have insurance, take care of, all my problems. But unfortunately, there's a lot of shortcomings with this medical system that we have that, I'm sorry, and it's kind of hard to say, but it's failed the way that it's been set up, even despite amazing medicine as the delivery of it. But patients have this mindset, understandably, that, hey, I'm paying a ton of money for insurance. Why is insurance not covering this? And one of the ways that we approach it is, first of all, we really emphasize and focus on the individualized treatments. There's so many patients that we get story after story where I'm not heard. I'm kind of pushed along and not heard. And when we have the time to sit down and talk to them and educate them, and we'll tell them, we do everything that all the conventional medicine will do it, and we do it when it makes sense to do. But we want to educate you on what's available. And unfortunately, this type of medicine is far more advanced than our failing medical system, unfortunately, which they really should catch on to it, because, some of these regenerative treatments, albeit they are, there is an investment. It's less with time and resources compared to surgery. So that
if you take into consideration, pardon me, but in conventional medicine, a doctor comes in and says, let's do the knee, and you got $50,000 in a knee versus $5,000 in an injection from here. It's 1/10 the cost. And we know from a sustainability standpoint that these things can work for 6, 8, 10 years. It just depends on the lifestyle people adopt after they do this. Eating better, exercising, doing all the things properly that they need to do, even in your later years, lifting weights, doing stuff like that make it better. Any comments from you guys?
Well, yeah, absolutely. Not to mention some of the cases that we've had so far with stem cells are people that have already had surgery. And just because you have surgery doesn't mean that it's going to resolve the problem. We have a lot of cases like this. Carter just recently.
Yeah, D1 lineman, big guy. He's 28. Lateral meniscus tear when he was in his final year of college, and they ended up, they thought I'm not sure how complex the tear was prior to the surgery, but they ended up doing a complete lateral meniscectomy. And I mean, now he has great work, chondromalacia on that lateral tibial and plateau and condyle, and we predicting that's kind of where that mechanism of action comes into play. I thought, what can I do to almost create a scaffolding to help support the knee, because it's grinding where it's not supposed to. And I mean, we did stem cells, combined it with PRP, and then did another PRP in a month. And we reached out to him a couple weeks ago, about 8 months later, and he's less knee clicking. He said it would pop out of place multiple times a day. It no more constant aching. He's almost pain free. Maybe a 1 if he exercises a little bit too hard, but then that ended up going away. And so, I mean, we're really pleased with Outstream.
Did you guys use IntelliFat on him, or just the PRP, or did you use both? IntelliFat. Okay.
With IntelliFat, the processing the way that it's created, like we believe, like we think that it is the best way to do it. That's it. We want the best results, and that's why we chose intelligent. Like, like once again, the results have exceeded our expectations.
Sorry,
You're getting. Go ahead.
I might have missed your question. Were you saying, did we use it with PRP product?
Well, it sounds like you did PRP and IntelliFat, or did you just use IntelliFat? You did both.
Yep, kind of the combination of the two.
We often will do a combination.
Well, it sounds like he had a really severe case, so I could see where it was probably necessary. And so you started a little bit less strong with the PRP, and then you ended up doing the IntelliFat after you did it. It was one of the later procedures. Would that be right, or was it the first?
We actually combined them same day. And so I actually want to give a shout out to Paul Tortland. He runs the New England Stem Cell Institute. We've been communicating back and forth, and we kind of adopted some of his plans as well, where you use PRP same day, and that actually helps provide an environment for the stem cells to survive and gives more platelets and growth factors and angiogenesis stimulating factors, so it can build those new blood flow pathways, so the tissue actually becomes a live organism. It's not just an injection; it's part of your body at that point. So,
well, Paul Tortland has done several videos for us, and so I think we got to you as a result of Dr. Tortland. So we're very, very familiar with Dr. Tortland because he uses a lot of our kits every month. So it's good. So question for you on, where is this headed? Can you discuss any case or clinical evidence? And I know we've got some, but I thought maybe you guys that support the use of IntelliFat kits. Obviously, you understand the process. You know how this works. You've been trained in doing it and in injecting it into the patients. Anything that you found additionally that would help somebody who's listening to this, whether they're a physician or a patient, say, hey, there is clinical evidence about this?
Yeah, it is in its infancy, and there are so many physicians that are starting to publish, and that'll come with, and that continues to increase with time, and that's important. And we embrace evidence-based medicine, and we continue to see more and more evidence, whether it's imaging, like even ourselves with the ultrasound that we'll do, we're seeing obvious changes in addition to the clinical effects. Yeah, but once again, I think that it's important to also give the experience and the practice of medicine is due respect, because the evidence is emerging, but we're seeing on a daily basis the feedback that we get from the patients. And I think that the statistic that you mentioned with 85% success rate, we are certainly seeing at least that. Like we're getting good response with every patient that we've done that.
Well, we're actually seeing long-term results too. So these aren't like, okay, I injected you and a year later, nothing. We're actually seeing long-term healing, right? So it's really a good effect, and it's a strong vote for the use of fat in injectables or adipose to actually do this. Now, you guys are using all kinds of other things in your practice too. I've been to your website. You're kind of leaders in regenerative medicine and the way in which you approach it. Where do you see this headed in next 5-10 years, especially with advancements in minimally invasive technologies? That would be one thing. I mean, look, we're growing cells now, right? Now, instead of taking them out of your body, although the FDA says you have to inject those back in, for anyone listening, you got to do it the same day. The process has to be within the same day. So unless that law changes, I don't think growing cells outside is going to be something we might be doing. Do you see any other things?
I think what I see is conventional medicine having a lot of shortcomings. And even doing this for a few years, each year more and more people are approaching us with regenerative medicine. And the future is now with what we have. And I think the first task, and the reason that we're so glad that you have a mission to spread this message, and we want to spread it too, is there's so many regenerative treatments that people just don't understand available or don't know how to get. And I think that we're going to see people continue to look at answers that they're not getting from conventional medicine, and they're getting it. And I think the more people that learn about the options with regenerative medicine, we're going to continue to see more and more people start to invest in themselves, and hopefully conventional medicine to follow suit.
Yeah, I would like to go off of that too. You said talk about what else we can implement, and the body works on the outside as well as it is on the inside, right? And so we're trying to incorporate like hormone replacement therapy, natural ways to decrease cardiovascular disease, focus on peptides that stimulate tissue repair on their own, or release more levels of your own growth hormone to kind of fight that aging response. I would say the hardest part about all of this is we have an abundance of things that we can do already. The hardest part is integrating it into each individual person as specific as possible. But yeah, no, I mean, absolutely falling in love with the field, and I want to keep progressing it with Trever.
I think one of the things I recently heard, guys, and I don't know if you can attest to this, but you know how we get body scans, and if you go to a hospital, because there's the machine there to do it, they're now saying that we're going to get to a point where we could do a full body scan, which I think, looking for osteoarthritis, looking for challenges that we're having internally, including heart issues and so on. It seems like it might be moving in a wave toward conventional medicine adopting it, because they can prevent challenges that are going to cost them more money actuarially from an insurance standpoint. So what I'm hoping is that people like you and other doctors who are using our kits are going to be at the forefront. There obviously are right now at the forefront of it, and bring heightened awareness to, honestly, really, the insurance carriers to say, okay, we're going to start covering this because you're paying us a heavy premium anyway. And by the way, it's going to save us money actuarially, and long term, it's going to cost us less money, because really that's what we've got to look at, is the optimal health, like you guys optimize you health. I mean, we got to look at optimal health, and we have to look at longevity. I mean, people like who are doing podcasts out there every day, doctors that have kind of taken, like you guys have, they've said, no, we're not going to do traditional medicine. One of them is Dr. Peter Tia, has a huge podcast show listened by thousands of people about longevity, wrote a book on longevity. We're starting to see at the forefront of the spear, people are interested in this, are really taking a hold and saying, hey, I'm going to do something about my own health. I'm not going to wait for somebody to tell me. Are you finding that too in your practice?
That was said so well. And I appreciate that. And we're seeing that. And sometimes the future might be going back to the past and doing the fundamentals well that should have been done right the first time. Right? We quite frankly need to just look at the failure for what it is. For example, I have a 40-year-old patient, does CrossFit every day, mindful of what he eats, doing the right things, and his cholesterol was off just a little bit. And so we said, like traditionally it would be, hey, lifestyle modification. We said, you know what, let's take this a step further. We did a screening exam with a coronary calcium score. It turned out that he was moderate high risk for arterial disease. He was a walking time bomb at 40, despite very small changes in his cholesterol that 99% of the time in conventional medicine would be overlooked. We've been able to intervene, get everything perfect. We using, once again, conventional medicine, pharmaceutically, and then once again, really taking seriously the lifestyle modifications, details, not just empty words about, hey, nutrition, doing, these general guidelines that nobody's going to do, but meeting with a trainer and a nutritionist. And that you think about what would have happened if we would have caught this 10 years from now, when he was completely occluded and he was in the emergency department for a widowmaker. There's a guy with young children. And so, yeah, I think,
Well, you guys probably know this, and I'm speaking to the choir here, but over here where I live and by San Diego, there is two machines, one at UCSD and another one in Encinitas, the city that I live in, where collateral arteries are actually being forced to grow as a result of compression. So they're actually compressing the arms and the legs and the body, and you go through these treatments. It's about $6,000. But the reality is if you look at Dr. Gandhi, there's been paper written on these people who come in who've had triple bypass, and then they say, no, you got another bypass. They go through this process with actually developing greater collateral arteries. Now, I think one of the best ways to develop collateral arteries is obviously exercise, right? And the more you exercise, the more collateral you're going to have. But for people maybe a little bit more sedentary and aren't doing that, this machine compresses you and actually creates the collateral arteries, and people are up doing what they were doing and lifestyle change and no triple bypass, right? So, I mean, it's pretty amazing where we've gone with this alternative therapy. Again, it is alternative, but it should be conventional. It should be something we're doing instead of going in and cracking someone's chest and opening them up and, taking the vein out of their leg and putting the artery in. It should be, hey, let's try this first, right? Let's do this.
No, let's be.
So, go ahead.
Not react.
What? Not react.
Let's just be proactive.
Yeah. Well, what advice
go ahead.
Oh, go ahead. Go ahead, Trevor.
Oh, I was just commenting on what you were saying, but I think conventional medicine lags so far behind the innovations. And so having, once again, that's what we love about our practices. We can stay ahead of the curve and not be limited with some of those things that you're talking about, because you're 100% right. Like the thought of cracking open somebody's chest instead of doing some compression, you look at the risk versus benefit. There's no question.
Yeah. Well, look, you guys have been wonderful being on the show, and I have a final question here. What advice would you give patients who are listening to this show, or other physicians who are regular MDs or whatever, who are considering changing their practice, about the use of regenerative medicine treatments for pain management, for almost many of the things you're treating? I'd love to get you to give our listeners some advice.
I am a huge proponent of patients educating themselves as much as possible. And we have so much available to us. And I have 100% confidence, and I see it when the patients learn about what's available, it makes the decision, very easy a lot of the time with making the decision to use some more of these innovative approaches that are quite frankly just less invasive. And so, sometimes in medicine, doctors get upset that people are consulting Dr. Google. I say, please consult Dr. Google, and then let's have a conversation about it. Yeah. Let's work together, because medical degree is on Google. It's all out there. You have
or it's Dr. Chat GBT now.
Absolutely.
Because I've never found something that you need to check it out, but I'll tell people, type in almost any question and Mr. Chat GBT is going to come back with some kind of answer. Now, it might be wrong, but the reality is there's a lot of truth in there as well. So you have to filter through it. But we have more information at hand. Yes, we seem to be a little bit dense about how we could go about doing this. And I think the key here today is we have two professionals that have been on the line with us. One, a doctor, the other one, a PT. I'm just going to say you're PT because that's what's on your deal, but you're more than that. Yeah. And the reality is that, with lifestyle changes, with using things like the IntelliFat kits, where your pain is today, it could certainly be relieved as a result of looking at some alternatives, whether it's IntelliFat or something else. How do you guys keep yourself updated on all the developments in this field, and what new things or methods are you thinking about adopting or have adopted, or where do you see it going?
Yeah, and go back to the advice of other physicians is what we found ourselves, and it is just that. It's always learning. There is so much available at our fingertips. There's so many awesome webinars by reputable organizations that are available very conveniently that we try to take advantage of. Some of these organizations, AAOM, Toby, there's more that are providing so much information and doing it in the validated scientific method that we're used to with our formal training. And so we love those conferences. We love seeing other providers that are doing what we do it right, as we like to think, where they're just using the best medicine. They're open-minded. They're innovative. And so we try to do that. And we really try to embrace what you hear as a cliche is the practice of medicine. And it's understanding that we come up with unique problems, and instead of trying to put everybody into a few diagnoses and treatments, it's really understanding that process and taking each of the complaints at face value and not being dismissive with the patients. But it's a continual learning program that we just love, especially getting the results. One of the things that we're really looking at with Next Up is advanced expanded laboratory tests, with looking at the genetic component in really being able to fine tune these treatments that we're already doing. Like, once again, using a adipose treatment on somebody, we know that if their health, and we understand their genetics, we understand the gut biome, all of those things that we can do to create the best healing environment, the more success they're going to have. And so we're really interested in those adjunct treatments, and really expanding and taking advantage of these testing.
Yeah, it's important.
Yeah.
Carter, any parting words from you, Carter?
Yeah, I mean, Trever does a good job at explaining all that. But I kind of look at every patient as an opportunity for learning. I hate that there's been, I'm a younger provider, and so I kind of like that aspect of it, because I have so much more to learn, and I've also learned so much just in the field. But like in my first rotation, it was outpatient internal medicine. It's like I would see a patient have a problem or a symptom, they'd be put on a medication. A couple of years later, whatever, they're developing other symptoms, and the next thing you know, you're prescribing a medication that's never existed in our environment naturally ever, and you're treating symptoms because of medications with more medications. The next thing you know, they're on 20 plus medications. I just want to let people know, like, don't be afraid to tackle any problem. Like, if you come across something that you're not sure of, or you're scared to take a gander at, like, use it as a learning experience. And I try to follow up even with patients that I refer out. I want to know, like, if there was something else that they were able to achieve. And there's a lot of patients that have been looking for, years for some sort of relief, and were their last hope. And now they're, lifelong patients. And so I just think every opportunity that you have to advance and learn, look it up, ChatGPT, other medical websites, webinars, everything. So, yeah.
Well, that's a good point. And I was going to say, because I think that Trever and I discussed this on our pre-interview, Dan Buettner's been on this show, and he's the guy that did the blue zones, right? And the important thing about blue zones is all about longevity. Where did these blue zones exist? And then what happens in those blue zones? What's actually happening? And the reality is, what you guys are doing around lifestyle is really what creates longevity in our life. And the important thing is people want longevity, but they also want it without pain. So additionally, you're creating the without pain part of it, because an older person wants to be able to walk 3 miles a day without having that pain in their hip or their knee or their shoulder or whatever. So my hat's off to both of you for doing what you do, For all of my listeners, you can go to www.optimizeyouhealth.com. If you're in the Chandler, Arizona area or any of the surrounding Arizona areas, please check out their clinic. Check out Trever Wilkins. He certainly is somebody who's very well known in this thing, and Carter, and give him a call. Actually, go in or text the person at the bottom of their website there and ask a question. It's been a pleasure having you guys both on Inside Personal Growth, and I look forward to having you back again someday soon.
Oh, thank you so much. It's been a pleasure.
Thanks, Greg. Nice meeting you.
Nice meeting you. Thank you for listening to this podcast on Inside Personal Growth. We appreciate your support. And for more information about new podcasts, please go to InsidePersonalGrowth.com or any of your favorite channels to listen to our podcast. Thanks again, and have a wonderful day.